before and hyaluronic acid. Could you explain?
Yeah. So PRP is platelet-rich plasma, which means that it's the patient's blood is being used. The procedure starts by drawing blood from the patient, not a lot, like a vial, and then it goes into like a special centrifuge, like this one, and then the procedure as well, another procedure, and then you extract only the plasma and the platelets and all the growth factors that are in the patient's blood. The good thing about it, it's from the same patient. So allergic reactions and other problems with that you can see in other things and other medications, you don't have it because it's just been drawn for the blood. It's a very good procedure in the right indication for problems with tendons, arthritis, problems with muscle injury. So these are all procedures that PRP really helps patients. We use it a lot in sports, we use it a lot in the adult population for arthritis, problems with the shoulder, tendons of the shoulder, tendons of the hip, and cartilage problem.
And hyaluronic acid?
Hyaluronic acid is something that we have all over the world. A lot of types of hyaluronic acid. Hyaluronic acid is, you may know, maybe patient get injection in the face for aesthetics. It's not the same. It's not exactly the same, but it's pretty similar. Hyaluronic acid is part of the synovial fluid that inside every joint we have. Every joint we have, either the wrist, the knee, the hip, have fluid inside. This fluid helps the movement, helps the joint glide one over the other, helps people, it has some anti-inflammatory properties. And the injection that we give is for when patients have arthritis. The hyaluronic acid in their knee or hip or joint usually deteriorates very fast, and the level of hyaluronic acid is low. So when you inject it to the joint, you raise the level of hyaluronic acid to help a little bit with the properties of gliding and some anti-inflammatory. So that's the major issue. Again, you have to do it in the right indications, and it helps. If you use it in the wrong indication, it doesn't. Okay.
Did you hear something about coral bone? Our Israel
company.
Yeah.
I'm part of the research on it. Part of the group that does research on it. So it's still in research. It's good for specific.
Could you explain, because
So the problem with the cartilage injury is that cartilage doesn't regenerate. Okay? It doesn't regenerate back. So if you have a specific lesion, specific problem with an area, then sometimes what you do, this company is trying to do, taking a coral that has specific characteristics, and you make a hole in the cartilage that is injured. You put it in, and cartilage, it helps cartilage build over it. That's the concept of this. It's a very short procedure. It's a procedure that is done in half an hour, 45 minutes. You do it arthroscopically assisted, with arthroscope. The good thing about it, it's most of the procedure for cartilage, sometimes you have to do multiple procedures. In this procedure, you can just take a small piece of coral off the shelf and put it inside the knee. You don't need anything from other patients, or doing a couple of procedures taken from you and put it in another place, which is usually done up till now. But it's still in research now. It's still we're evaluating it. I don't know if it's viable for if we can do it for tourists that come to Israel. I'll have to check that if it's interesting for you. If it's a procedure the patients are asking, then maybe we can try.
No, it was just in news. But
No, in news, okay. It's a very sexy topic for, coral. Well, they usually take coral from Malaysia.
Malaysia.
Yeah, they take like huge corals. They buy it, they bring it to Israel. The company is in Kfar Saba, Kfar Saba. They make like small, like cylindrical pieces. And you prepare the bone, you put it in, and then cartilage builds on it.